Okay, it's after 7 o'clock, so we'll get started. Hi everyone, happy Women's Month. My name is Tegan Hughes. I'm the digital storyteller for Ontario Cycling. Wanted to extend a warm welcome to everyone joining us tonight for this important conversation on topics relevant to female cyclists, including saddle health, pelvic health, and injury prevention. I'm very excited to be joined by Ali Hodgins, who's a highly experienced physiotherapist with more than 15 years in the field, including 8 years working in high performance cycling. So I'm going to pass it over to Ali for an amazing presentation. If you have any questions, feel free to put them in the chat or raise your hand.
Thank you, Tegan. And thank you, Ontario Cycling, for having me again. I've done this a couple of times with Ontario Cycling, and I always enjoy sharing this information and talking about this stuff because we don't talk about it enough. And so I'm really grateful to you guys for having me out today. Um, Before we get started, I'm a physio, so I'm good one-on-one. So these presentations tend to make me a little bit nervous. So if you guys have questions, please fire them out at us. I'm sure Kim and Tegan are going to monitor the chat, and feel free to please interrupt me if there's a specific topic before we move on. If you want to know more about it, or if you have some specific questions, please let me know. I love to have more of a discussion than me talking at my screen. So please let me know. I'm going to start sharing my screen. Okay, Tegan, can you let me know if that looks okay? Good. Okay, good. So, yes, thank you for coming. We're going to talk about saddle health considerations for the female athlete, for the female cyclist. I have a little message there at the bottom that this presentation focuses on cycling athletes with a vulva. I recognize that not all athletes with a vulva identify as female, but for quickness of this presentation, we're going to talk about the female anatomy, the vulva anatomy, when we're talking about this. And I do want to let everybody know that I'm a physiotherapist. I love anatomy. We talk about anatomy a lot every day. And so I will use the proper anatomical terms for the area that interacts with the bicycle seat. So I just wanted to let everybody know that, just in case it makes you uncomfortable, but I will use the proper anatomical terms for everything. Okay. So, little about me. Click to the next one here. So this is me. I'm a physiotherapist. I've been a physiotherapist for over 16 years now. 8 of those, actually 9 now, have been working in high performance cycling. I'm also the director at the Health and Performance Center at the University of Guelph, where we have a sports med clinic on campus. So a little bit about what we're going to talk about today. We're going to talk about the definition of what saddle health is. So it's a bit of a kind of a vague term, but we're going to talk about a definition that we've developed on exactly what saddle health is. We're going to talk about the anatomy of the area of your body that interacts with the bicycle seat, and that mainly is the vulva, but there's a lot more to it than just that external skin. So we'll talk about everything that's going on down there, which is quite a lot. We also want to know what the literature says about cycling and saddle health, especially female saddle health. Spoiler alert, not a heck of a lot of research on female saddle health, unfortunately. Pretty across the board that female health is under-researched in our healthcare system. And so being such a niche area, saddle health, it's also very under-researched. Hopefully that changes over the next little while, and I'll talk about some emerging research right now, but we'll talk about what we currently know about that. I have some personal stories, some good stories about working in elite track cycling. We'll talk about some typical saddle health issues, some basics around prevention, a couple of management strategies that you can use right away, and then a couple of long-term consequences if you have saddle health concerns that you kind of let fester and let them go for a long period of time, and what that can potentially lead to. So this isn't meant to scare you, but I do want to say, like, we need to manage our saddle health issues and get those under control, because it is a very important and sensitive area. So let's talk about what is saddle health. We have a nice long definition there. I'm probably going to have to take a breath halfway through. But Saddle health is the physical condition of the area of your body that interacts with the bicycle seat. Saddle health issues can include, but are not limited to, pain, bruising, swelling, chafing, redness, pimples, open wounds, abscesses, nodules, tingling, numbness, hypersensitivity, and sexual dysfunction. So there's a wide range of things that can go on in that small area that interacts with the bicycle seat. And I have a nice quote here from Laura Brown, a coach that I work with from Cycling Canada. She's also an Olympic bronze medalist in the team pursuit from Rio. A saddle injury can derail a great training plan and force you to take time off the bike at a really inconvenient time. Laura says, my worst saddle sores came when I was training for the Rio Olympics. And even Rio is 2016. It's not that long ago. And a lot of Laura's training, she says, was done on saddles and in cycling shorts and chamois shorts that were built for men. And so we have come a long way, but we still have a long way to go in managing female saddle health. So let's talk about the anatomy. There's a nice picture here, and I especially like this picture. So you can see that this is the internal anatomy of the female pelvis. It is pictured from below. So if you imagine that the woman is basically standing over you, and then the soft tissue and the skin has been removed, it is super interesting to me because it actually, if you look at it, it looks like a bicycle seat, doesn't it? So we've gotten something right. But I wanted to emphasize here the bony structure in and around the pelvis. So we can see the sit bones out here. I think you can probably see my cursor. So those wide parts there are the sit bones or the ischial tuberosity. We've got the mons up here where we've got the labia. We've got the clitoris at the top, your urethra, and then we've got the vaginal opening up here. And then this here is the anus, the anal opening. And we can see all these nice circular pelvic floor muscles. We can see the yellow lines here, which are nerves, and there's a lot of nerves in the area. And then we can see these red and blue lines, which are our blood vessels. So arterial supply and venous supply to the pelvis. Back here, this white part is the tailbone. So you can see that there's a lot going on underneath the skin, underneath the fatty tissue and the labia majora and minora. There's a lot going on once you remove that. So I wanted to put this picture up so that everybody can understand that it's a very complex area. Next, we'll talk about some of the research. And there's a lot up here, but unfortunately, the majority of the research is on men. And because male erectile dysfunction is a big, scary thing for men, there's a lot of research on it. And because of the importance of the blood supply to that area for sexual function, male erectile dysfunction has been very well researched, and especially when it comes to the bicycle seat. And that's where they actually developed that cutout in the bicycle seat to relieve some of the nervous structure and the blood vessel supply to the penis. That was made for men. So what they don't necessarily research very well is erectile dysfunction in women. And so the clitoris does become erect during sexual arousal. And so that requires a lot of blood supply and that requires a lot of sensation. But because it's not as obvious as male erectile dysfunction, it is very under-researched. So unfortunately, we don't get a lot of information on that, but we can imagine that prolonged pressure can affect that. We just don't know to what extent. So what we do know from the research is that an excessive amount of drop, so that's the handlebars being really low compared to where the saddle is, that can really affect the pressure in the saddle area, and that can really affect soreness in the saddle area. And we know when you move to a more aggressive position in your bike, so think about a nice upright mountain bike position or a spin bike position or something like that is relatively comfortable. And then you get into more of a row position, and then you get more into a track or an arrow position or a tri position. The more aggressive you get, and the lower your upper body gets, the more pressure it puts on the saddle area. So that amount of drop can really affect the pressure in that area. And that's well established in the literature. We talked about cutouts just a second ago, and that was originally developed for men. Some women do find it really helpful to have that cutout, and some women actually find it really uncomfortable, almost like their labia or their soft tissue can migrate towards that cutout. And so some women find it very uncomfortable and prefer a full, but maybe a pressure relief area on the saddle. We also know from a research study that people who change their position a lot, so if you're constantly futzing with your saddle height or your saddle position, constant changes in position can actually really irritate your saddle health as well. A constant position can really help to lead to increasing your tolerance for sitting on the saddle. This is a study I wanted to put up because it's actually not published yet. And it's one that I worked with the researchers from the University of Tennessee on, where they only looked at competitive cyclists. So female cyclists that raced. And you can see from the data here at the bottom that it's quite a significant issue. But what I wanted to highlight was 40% of these women reported that a prior bike fit had actually negatively contributed to their saddle health, which is kind of scary to think because I'm going to talk about why a bike fit is really important for saddle health. But it's important for your bike fitter to actually ask you about saddle health, because if they're not asking you about your comfort in the saddle area, they're neglecting a very important and, in my opinion, the foundation of a bike fit. I've had many athletes ask me about, the numbness and erectile dysfunction and difficulty achieving orgasm. And unfortunately, a lot of this isn't necessarily captured in the research, but we're going to talk about some of the things that we do know in a little bit. But I wanted to highlight this research article that hasn't actually yet been published, hopefully soon, so you can all read it. So we're going to talk about the basics. And I did a saddle health talk for a group out of Alberta. And the whole program was called Take Your Panties Off, which I loved. And I actually stole that from them. So one of the basics that we need to keep in mind is when we're wearing our cycling shorts, so our proper cycling shorts with the padded area, that you need to take your underwear off, and you don't want to wear extra fabric between you and those cycling shorts. They're meant to be worn directly against your body. You want to wear a cycling short that has a pad that covers all the contact points with the bicycle seat. If that pad is too far forwards or too far back, which I find a lot of cycling shorts for me will sit too far back, and because I'm a flexible female, I tend to be a little bit more forwards in my position on the bicycle, that I'm not often completely covered by the chamois pad in those shorts. And so I need to find shorts that have a little bit more of an anterior position to that pad, because otherwise I can get quite sore in through my pubic bones that lead to the pubic symphysis to that front there. I also wanted to mention here that pubic hair down on the vulva serves a purpose. It's actually there for a really important purpose, and it is to decrease friction between you and the bicycle seat. And so our fashionable thing these days is to completely remove the hair, either with waxing or shaving or laser. But that hair actually serves quite an important purpose, and it protects the skin in the area. And so we do recommend that clipping is the preferred form of grooming, personal grooming. There's other reasons why waxing is an issue for saddle health, and that's, damage to the skin and that sort of thing. But that pubic hair really does serve a purpose. And I'm contradicting myself a little bit here by saying that bike fit can really help if your fitter is talking about comfort on the saddle, then they're likely going to be able to help you. But if they prefer not to talk about it because saddle health is a little taboo and a little uncomfortable, and sometimes you have a male fitter for a female athlete, and so that can get a little bit uncomfortable talking about soft tissue or vulva or labia or that sort of thing. And so um, oftentimes that can get overlooked in a bike fit, and that's when you can get into trouble. However, if your fitter is comfortable asking about your comfort on the saddle, then it's probably a good idea to talk about. Well, it is a good idea to talk about it, but it's probably going to be a helpful bike fit. And obviously, there are, bike fitters out there with more experience in this area than others. And so that's something that you can definitely ask your fitter about. Like, are you going to be talking about this? Are you going to be assessing this on me? Do you use pressure mapping, that sort of thing? So definitely something that you should mention if not asked about. And then we'll talk about the chamois pads. You kind of get what you pay for in those cycling shorts, unfortunately. It is a little bit of an expensive sport. And if you do cheap out on your bike shorts, you may actually notice that you can get quite a lot more soreness. There is some good research that's gone into developing the density of the foam and where they put it on the pads and where where that chamois pad is sitting in the cycling shorts. And so you kind of get what you pay for with those things. With this presentation, I always get a lot of questions about chamois cream. Should I use it? Should I not use it? Which brand should I get? It really does come down to personal preference, but just like we talked about with the pubic hair serves a purpose for decreasing friction between your skin and the bicycle shorts, the chamois cream can also serve as a friction barrier. So it can be quite helpful. And then saddle shapes. I always get a question about like, what kind of saddle should I have? Saddle shapes are a very personal choice. And, if it came with the bike or your friend rides it, it may not be right for you. And so unfortunately, again, it takes a little bit of trial and error, just kind of like those chamois shorts as well. It can take a little bit of trial and error to find the right bicycle seat for you. But again, a bike fitter should have a bit of a library for you to try. And if they don't, then you might want to, talk about like, can I try this? And if I like it, then I'll purchase it, or I'll purchase it, but I'll bring it back if it doesn't work for me. And sometimes you have to ride it for a ride or two to figure out if you like it or not. We'll talk about saddle shapes and that sort of thing in a little bit and some of the considerations for that. So some typical issues that we see, we talked about that a little bit in the definition. We see skin changes. So that's that, rashes or a little bit of that, what's the word, like chafing on the skin where it changes red. It gets a little bit red. We can also see labial hypertrophy, so a little bit of swelling, and we can see that sometimes on one versus the other. And we do know that women aren't perfectly symmetrical. The labia and the vulva isn't perfectly symmetrical. And so oftentimes we have one labia that's a little bit bigger than the other, just like, you might have one breast that's a little bit bigger than the other. We're not perfectly symmetrical. And so oftentimes if one is a little bit bigger, say your right side is a little bit bigger, then that can increase the compression and the friction on that side, which will increase the irritation. And that can actually make the size difference more exacerbated, so worse. And so that's something to consider. Oftentimes, athletes who have like a leg length discrepancy, if they have a shorter side, they'll notice that their labia ends up getting bigger on that short side because of all the friction on that side. We can also get ingrown hairs or those inflamed sebaceous cysts, those little nodules that feel like they need to be popped. We see infections quite often, unfortunately, and because it's such a moist, warm area, it is really quite a breeding ground for infection. And so I definitely don't want you to have an open wound and just, oh, it's no big deal. It's just a little bit. There's a story, and this is a man, but bear with me. A man from BC that was on a bike packing trip that got a saddle sore. And he kind of just ignored it and thought, I'll deal with it when I get back, when I get home. And he ended up in the hospital with an infection. And he actually was septic. So he needed to be in the ICU for quite a while. Unfortunately, he did survive. He is okay, but you don't mess with infection because it can be fatal at times. So we want to make sure that if there's any open wounds in the saddle area, that you're treating that effectively with ointment or polysporin or something like that. And then we can get nerve compression or entrapment. So we talked about that pudendal nerve a little bit in the anatomy slide. You can get those nerves that kind of get trapped or compressed. And it's not necessarily like, a pinched nerve in your back where you get that sciatica. It's not the same kind of acute, all of a sudden you get it. It's that nerve compression over time that can lead to that irritation where it can get either hypersensitive, so too sensitive, where even just brush of clothing feels painful, or you can get a lack of sensation. And that's when we really worry about sexual function, because this area is technically for sexual function. It is very innervated. It has a lot of nerve supply because it's supposed to be sensitive, because it's supposed to be an area for pleasure. The other thing I want to talk about is pelvic floor tension. So if there's a lot of pain or discomfort in the saddle area, then we know that a pain signal tends to increase pelvic floor tension, and then that can lead to urinary issues, incontinence, and that sort of thing. So we don't want to develop a whole lot of that pelvic floor tension by trying to hold ourselves up off our bicycle seat because it's uncomfortable. And then also medical concerns. So there's potential for UTIs because, again, we talked about that bacteria in the area. Vaginitis, where you can get bacteria getting into the vagina, and then sexual dysfunction from the compression of those blood vessels and nerves. So those are extreme examples, but definitely potential outcomes if you let your saddle issues perpetuate. I just wanted to highlight the pudendal neuralgia again. So this is something to pay attention to if you get that painful or numb area. It's usually on one side. It's usually relieved by changing position on the saddle. So you can get up and out of the saddle, standing up, or even at a stop sign, getting off the bike, getting your coffee if you're on a coffee ride. But the thing to remember, especially with this numbness, is that if we're coming out of our indoor season now, but if you're on Zwift for a long period of time, there's no stop signs in Watopia. So you got to get up and off the bike and stand up and relieve the pressure in the area every so often. Or else you get off the bike and you're like, oh man, it's numb down there. When did that happen? You don't always notice it until you get off. And so you definitely want to make sure that you're monitoring any numbness in that area, because the pudendal nerve is very sensitive and important for sexual function. So let's not mess with that. And I do want to mention it can be relieved or exacerbated by cutouts on the saddle. And this is where we talked about earlier, those cutouts were originally developed for men to relieve pressure closer to the center, which is where their nerves are. Our nerves are out wider because of our wider pelvis. But the men have it a little bit closer. And so that cutout is to relieve pressure for their nerves. But some women like it, some people don't. It's important that your saddle choice is very personal and specific to you, because everybody is a little bit different in that area. And I wanted to bring up this picture. It's a little grainy, sorry, but this is a picture that I just stole off the internet of saddle pressure mapping pictures. And you can clearly see that on the right, that doesn't look overly comfortable. On the left, the pressure is a little bit more distributed. So some bike fitters will actually use pressure mapping to help you decide if a type of saddle looks like it's right for you. But ultimately, you are the one to decide, because it's either comfortable or it's not. And so that's something where they can help you navigate the massive amount of saddles to choose from. However, it still is a personal choice, and you have to feel the comfort rather than them just telling you this one looks good for you, even if you're like, I don't like it, it doesn't feel great. So that's something to consider when you're having a bike fit. So let's talk about some contributing risk factors for saddle health issues. So it's getting to be nice out, although today's a little bit chilly. Today it's sunny. We know that when it starts to get nice out in Canada, we all want to be out on the road, and we're going for our group rides, and it's longer than what we've been doing on the trainer, and we're going out multiple days in a row. So a sudden increase in volume can really aggravate saddle health issues. So some people notice like, oh yeah, when I switch to outdoor riding, all of a sudden I start to get saddle issues again. So that's something to consider that, with the nice weather, ease into it, everybody. We also know that changing to a more aggressive position, and I saw this a whole lot working with track cycling, when they be doing a roadblock in that nice, comfy road position, and then they switch to a slammed track position that's more aero, and that pursuit or that sprint position way down. That change can really aggravate saddle health complaints. We also know poor fitting or a worn out chamois. So if there's exposed seams, can contribute to saddle issues. So have a check for your cycling clothing, especially now that we're getting everything out of the drawer and dusting it off, getting ready for the outdoor season. Make sure that it's not worn out, that it's everything is still in good working order, because those can definitely contribute to saddle issues. If you wear your chamois for long periods of time, so we go for those nice long leisurely coffee rides, you're sitting sipping your coffee, eating your treat, you've sweat a lot, and so sitting in those cycling shorts for long periods of time, especially when you're sweating, can really contribute to saddle issues. So you definitely want to change out of those shorts as soon as possible. And then an inappropriate seat height or positioning. So that can be mitigated through a bike fit. And we'll talk about exactly what can happen with too high or too low, but inappropriate seat height is definitely one of those things that you want to consider. And then a poor saddle fit or design, a saddle that has broken down. So just like your chamois shorts, just like your cleats will wear out, your saddle can also wear out. It is a wear item. And so if you've had the same saddle for 10, 15 years, you probably want to change it out. Even if you're like, oh, but I love this one, it's likely breaking down. So you definitely want to have a look at it and see, are the rails still good? Are they bent? Is the foam still just as pliable in one area than the other?
Ali,
And then
sorry
poor
to
hygiene.
interrupt. We
Oh,
have a
yeah.
question in the chat if that's okay.
Yes, please.
So it says, what are your recommendations on when you have your period and you don't want to just bleed into the chamois, or should you and you don't use tampons?
That is a great question. And I've had this question a couple of times from some of my younger cyclists when I've talked about saddle health. So yeah, unfortunately, when we're on our period, if you don't use tampons or a menstrual cup, a pad is not recommended. So, like a menstrual pad or a napkin is not recommended inside the bicycle shorts. So, the chamois is meant to be directly against your skin. And that extra bulk of a sanitary napkin can actually contribute to saddle issues. And my recommendation for those young women that aren't comfortable using a tampon or a menstrual cup is just bleed into the shorts, because it's quite padded. They're usually black nowadays. They're not usually, a lighter color. And so if you're not comfortable wearing a tampon, then that's the next best option. Or maybe you just switch up your training and like, I'm going to go to the gym, or I'm going to take a rest day on my heaviest days, and then I'll go for my ride on a lighter day. But unfortunately, it's not recommended to wear a pad in those shorts. And so if you're not comfortable just bleeding right onto the shorts, which I say go for it, then it may be worthwhile just to take that day off or switch up your days. Hope that helps. We're going to talk about hygiene, and that's one thing that kind of leads into being on your menstrual cycle. So menstruating is a liquid, it creates moisture in the area, and so does sweating and that sort of thing. So poor hygiene can contribute to saddle health issues. And so you definitely want to make sure that you're cleansing the area after your ride, and make sure that you're allowing it to fully dry, and not letting that bacteria that builds up on the skin over time sit there for a long time. And then we also talked about personal grooming. You'll notice that I kind of hit some of these things a couple of times throughout the presentation. So shaving and waxing the pubic hair is not recommended. Clipping is the recommended form of personal grooming. And that's because shaving and waxing reduces or removes that friction barrier, but it also damages the skin and the hair follicle. So that can create areas where bacteria can get in under the skin and that create issues in the area. And then we also mentioned a leg length discrepancy as well. Sores tend to develop on that shorter side. So with my para athletes that have a limb that is either shorter from birth or shorter from an injury or shorter because of muscle contractures, that short side tends to be the one that's reaching for the bottom of the pedal stroke, and that can irritate the saddle area as well. So it's really important for that bike fitter to really fit for the athlete in a bit of a more neutral position. So if that short side feels like the saddle is too high, it probably needs to come down. Okay. So let's talk about prevention, and we will talk a little bit about menstrual cycle as well in a second. But I want to hit home that we always want to wear a clean, dry chamois. I know some of the manufacturer recommendations say don't put it in the dryer, let it dry. But I prefer my chamois to get nice and dry. And so I like to put them in the dryer on delicate, but in the dryer. And that way I'm certain that it dries within an adequate amount of time because I don't want any of that moisture kind of sitting in there for a long period of time. And then you always want to change out your chamois immediately after your workouts, clean the area. If you can't shower, if you're at a race and it's outdoors and you have to drive home, bring baby wipes with you because you can actually just cleanse the area gently with baby wipes right after your ride before if you can't quite get to a shower right away. And then you want to ensure proper fitting of those cycling shorts. So I mentioned the fore aft position of the pads. You want to make sure that the pad is actually sitting in the right spot for you, but also make sure that they're not too big or too small because that can contribute to saddle issues as well if it's not sitting snugly against your skin. You want to avoid using scented washing detergent and soaps as this can irritate sensitive skin. Some of us are more sensitive to scents than others. But that detergent when you're washing your cycling clothing can definitely contribute as well, especially if you get trapped in the pad of the cycling shorts. You definitely don't want that. And then use chamois cream as directed. You can definitely use it every time you ride or as needed, or some people actually find that it feels too slippery and then they can't anchor themselves on the saddle and so they prefer not to use it, but it's really a personal preference for each person. And then we talked about avoid shaving or waxing the area. Clipping is a recommended form of grooming. A little bit more on prevention, increase volume gradually. We talked about that on a previous slide about how increasing volume quickly can contribute to saddle issues. Some women have difficulty with the tampon knot on the string. So try using a menstrual cup instead. I did mention it's not recommended to use a sanitary napkin in the cycling shorts because it can create a friction spot if it gets wrinkled. But I say just bleed into the shorts because it's going to wash out anyways. I say don't worry about it. If your clothing is a dark color, then wonderful, even better. I do remember back in the day when the UCI had World Cup leader jerseys or leader skin suits, they used to be white. And I thought, oh my goodness, why why would they make it white? I get that it's a neutral color, but I'm grateful that they got rid of it because I worry so much about athletes being overly concerned about being on their period and in their cycling clothing, which is really form-fitting anyways. But if it was white, it's just even worse. So I want to say keep an eye on the area as well. And I've got a little mirror, picture of a mirror there. So if you're in a high volume block, I would say take out a handheld mirror and have a look at your vulva. Just stand over it and see what it looks like when it's feeling good and healthy, but also have a look when you're in a high volume block and see if things are starting to look a little bit irritated, or if you've got some nodules or something like that. Have a look at what it looks like. Is it angry? Do you need to take time off the bike? Because that is the easiest way to resolve some saddle soreness, is just to take some time off the bike. But I would have a look and make sure nothing looks infected, nothing looks overly swollen or irritated, and know what your body looks like down there, because it's really important. If swelling is a common issue for you, you can try using a cold compress after your training rides. So if you find that you get a little bit increased kind of swelling or edema down there, then you can add a cold compress. I will say this, please do not put ice directly on your vulva, directly on your skin. I've had to have this conversation a few times. If you ice your skin directly, you can give yourself frostbite. And so a cold compress is the recommended form of cooling the area. So yeah, ice directly on the vulva is a no-go. And then with cleansing, use an emollient maybe instead of soap. So harsh soap can dry out the skin. An emollient doesn't take the moisture away from your skin, and it tends to be gentler. And so an example of an emollient is a Cetaphil. And I generally recommend to people, treat the skin in your vulva, especially if you're a cyclist, but the skin around your vulva is very sensitive. Again, it's for sexual function, it's for pleasure. It should be really sensitive. Um, Treat it like your face. We have all of this like lovely skincare routine for washing our face. No, I use a cleanser that doesn't strip my skin of its moisture, and then I, pat it dry, and I'm very gentle, and yet we use just a regular bar of soap down there. So I say, think about your vulva a little bit more like your face and treat it as such. Let's talk about a bike fit. We're going to talk about saddle choice and how to choose a saddle and all the different variations that we can choose from. But I really like this picture on this slide because I do not want to sit on that saddle. But I think it's a really cool
Ready?
vintage look. But I definitely don't want to sit on that saddle. So saddle choice can really affect how you feel down there. We've got different widths, we've got cutouts versus no cutouts. We've got a split nose saddle. We've got different materials, different densities, different shapes, a pear shape versus a T shape, how much flare it's got. Is it 3D printed? Does it have mimic technology? There's so many different options. And so I recognize that it can be very overwhelming, but that's where a good fitter can help narrow the choice and say, these are the ones based on, your anatomy and how you sit on the bike that I would recommend for you. Choose which one you find most comfortable, is how I would recommend going about that. And then in a bike fit, they will want to look at saddle height. So if your saddle is too high, you're going to be reaching with that foot for the bottom of the pedal stroke. And then you're going to end up tilting your pelvis side to side and rocking a lot on the saddle. And if you've ever ridden behind someone who rocks a lot, think, does their saddle look too high? Are they reaching with their leg for the bottom of the pedal stroke? Because that can really grind the saddle area and create a lot of friction. And then saddle fore aft can definitely affect that as well. And so if you're constantly sitting on the nose of the saddle and then you're like, oh, I gotta shuffle my bum back onto the full part of my saddle, but then as I go and I'm not paying attention, I'm like, oh man, I'm sitting on the nose of the saddle again. That may mean that your saddle's just too far back, and that you actually need to move the saddle forward so that it's sitting underneath your pelvis and supporting you, rather than you feeling like you need to constantly go back onto the saddle. And then there's tilt too to the saddle. So nose down, nose up. If you're nose up, I don't know what's going on. I see a couple kids riding out on the streets, just going to school and stuff like that with their saddle tilted way nose up. And I think, I don't know how anyone can sit on that. But definitely you either want it level or even a little bit down. People who tilt their saddle way nose down tend to be trying to get away from some discomfort of some sort. And so that probably means their saddle isn't either right for them or isn't in the right position if they're trying to get away with just tilting it way nose down. Crank length has been something that's been in the news a little bit lately. There's a trend towards shorter crank length, and I can understand why. In too long a crank length means that you're trying to kind of clear that hip closed position at the top of the pedal stroke. And so you can end up rocking in the saddle as well. A little bit of a shorter crank length means that you might be able to spin a little bit easier. And so, yeah, that longer crank length can definitely lead to some tissue breakdown if you're rocking a lot in the saddle. I know longer crank length is good for torque development if you're doing, we talk about that a lot in track, but in road races as well. But a shorter crank length may be more comfortable, especially if you have a shorter leg, anyways. And then cleat position. So if your foot is really uncomfortable, then you'll end up transferring some of that weight somewhere else. And so cleat position can really affect how you're sitting on the saddle. So knees out, knees in, toes out, toes in, that sort of thing. So the cleat position should definitely be looked at in your bike fit, and not just from a power transfer, from a saddle health perspective as well. So I took this picture of a few of the saddles we had at the velodrome just to emphasize how different a few can be. And you'll notice that, on the right-hand side, we have a bit more of those tri-type saddles, or those pursuit type saddles with the split nose. And then the cutout goes all the way to the nose, but it's a shorter nose. Then we've got a long nose, and the cutout's only part of the way, and then it's a bit recessed towards the front. Some of them are wider, some of them are narrower, some of them have a bigger area that those sit bones sit on, some of them have a longer nose. And then some of the noses tilt off, some of them flare up at the back. So there's such a wide variety, and this is only a few different saddle options here that I took this picture of. But I just wanted to emphasize that your fitter should be able to help you narrow your quest down to a few selected saddles, and then you pick which feels most comfortable. And I think that's probably the best way to go about finding a saddle that's right for you. So we'll just talk about a couple easy, simple management strategies. And if anybody has any questions about these, please speak up. But the easiest thing to do if you have a saddle sore is to take some time off the bike. And that's obviously the worst answer, but the easiest answer for a saddle complaint. A bike fit is also a good idea. And I will again emphasize, if your fitter is not asking about saddle comfort, they are uncomfortable talking about it, and they are not the fitter for you. So find somebody who wants to talk about your vulva and talk about your comfort down there. One of my suggestions with my athletes who have to train on back-to-back days is have a couple different brands of bicycle shorts. So different types of chamois, a couple that you're like, these three I find comfortable. And wear different brands on back-to-back training days, because it will change up the pressure just slightly and take some pressure off some of those specific areas that might be getting a little bit irritated, and just change that pressure a little bit. If you have any open wounds or something that's looking a little bit raw, like you might be getting a little bit of skin breakdown when you are off the bike, I highly recommend using something to kill the bacteria in the area, like polysporin. And that can definitely help to prevent any infection, but you definitely want to be managing any open wounds with time off the bike, or changing up the pressure for sure. When you're off the bike, loose fitting clothing or even sleeping in the nude can be really helpful for saddle complaints. You need air to get at the area. You want oxygen to help with that healing process. And so very limited tight fitting clothing when you're not in those bicycle shorts. And then you want to wash the area like we talked about earlier with a mild cleanser right after you ride. Allow your vulva to completely dry afterwards. You don't want to trap any unwanted moisture in that area. Cold compress for swelling, or you can actually, there's some lymphatic massage techniques that some of my athletes have found really helpful. And so if you find a massage therapist that A, particularly knows cycling, or B, does lymphatic massage, and so some are trained in lymphedema for like post-cancer treatment, And so if they have lymphatic massage training, then they can help with some of the swelling that gets stagnant in the saddle area. If you notice that you have one of those nodules, where it looks like it needs to be popped, like it looks like a bit of a pimple, or it's a bit of a swollen area, and you're like, oh, if it would just drain, it would feel so much better. You can put a warm compress on that. I will say, please don't squeeze them. Squeezing them and trying to pop them actually increases the trauma to the tissues in that area, and it can increase the swelling and the soreness. So a warm compress or even a warm bath will help them to drain naturally. But yeah, don't squeeze them. And I tell you, I'm saying this because I don't want anybody to get any ideas, but I've had athletes ask me for acupuncture needles because they're like, oh, they're sterile. I just want to pop one of my saddle sores. And I say, absolutely not. Go get in a bath, let it drain naturally. But yeah, please don't try to lance them on your own. If something feels like it needs to be drained, go see a doctor and they can do it in a sterile environment. Please don't go trying to lance them on your own. And then anyone on here that is a mom knows the magic of diaper cream. So again, you think about having to wear a diaper and that moisture on babies' bottoms can lead to those rashes and those little pimples all over their bum. And diaper cream is quite often, a miracle. You put it on at night, the next morning it's cleared up. And so diaper cream can actually really help with some of those really rashy type saddle sores. So I have some of my athletes that use it regularly or even sometimes preventatively when they know that they're racing on back-to-back days. They'll bring some zinc oxide diaper cream, like the pseudo cream or something like that, and they'll put it on the area, and that really does help to keep the inflammation under control. And then we'll end on a high note, a low note, potential long-term consequences. So infection is no joke, and you absolutely need to deal with it. But infection can lead to lots of time off the bike, as well as scarring and potential other, life-altering consequences. So we definitely don't want to mess with infection. We also want to manage chronic inflammation. It can lead to that hypersensitivity that we talked about. So just the brush of clothing against the skin can feel very uncomfortable. It can lead to skin thickness changes. So we talked about the like labia changing in size and getting bigger. Sometimes your skin can even change color. And that increased tissue bulk, that increased hypertrophy to the labia can sometimes we've heard of. Has anybody here heard of labialplasty? I think the Brits were talking about it with their track team a while back. Some women were having to undergo surgery, plastic surgery, basically to deal with some of the hypertrophy in and around their labia because one got to be so big that it was completely in the way and they couldn't cycle with it anymore. And so they were having to have surgery to correct this. So we'll do everything we can to prevent that chronic inflammation that kind of builds up over time. Chronic nerve compression is also a problem. So that can lead to changes in skin sensitivity as well, which is that abnormal or uncomfortable sensations. But it can also have sexual implications for women. So chronic nerve compression, chronic vascular compression really does have a potential to lead to issues with that vascularization of the clitoris. So sexual dysfunction for women, it is similar to men, except that we can't see it. Men can see sexual dysfunction, women can only feel it. And so it often gets under researched or not talked about it as much. And so I definitely want to emphasize here that chronic vascular compression can lead to that numbness and that potential for sexual dysfunction. So, on that note, does anybody have any questions? I think I'm gonna stop sharing. We had one good question about the menstrual cycle.
Oh, yeah, you have your hand raised. You can go ahead and ask a question, or you can put in the chat and I'll read it out. Up to you.
Yeah, I'll just go on the mic. Thank you so much for the presentation. It's really great. So I have a question for you. I'm going to be riding for 6 days, about 100K a day, and that's my first time ever doing anything more than 2 days. And so I was
That's cool.
curious, kind of, what are some recommendations and things I should kind of bring with me to help the saddle help the whole time, and and just like what to keep in mind and any suggestions.
So probably a couple of those basic prevention things that we talked about. So having a couple different brands of bicycle shorts that you find comfortable so that you can switch up the brand on back-to-back days. Please don't wear the same one 2 days in a row if you haven't washed it. That is going to be a really important thing. And especially, if you're going for these really long rides, then it's it's important that you have either enough shorts to last you or access to laundry. So that's going to be really important. Um, have you used chamois cream before? Do you know if you like it? These are all things to try out to figure out what works for you. Um, make sure that you're building up your volume to be able to tolerate 100K a day for 6 days, because that is quite a lot. So you definitely don't want to be, oh, I've been riding, twice a week for, 50K at a time. And then all of a sudden I have to do 600 in a row. That's going to be quite a lot. So make sure that you're working up your volume for that as well. And then making sure that you're keeping an eye on your area. And if any issues come up, try to get them dealt with right away. But that's a great question.
Thank you.
Thank you. I see a Julia with their hand up.
Hi, and I see somebody's asked us very similar question on the chat. That was a question I was going to ask as well. So I've had two bike fittings, and I did the SQ Labs seat width thermometer measurement, and I measure 130. So when I did the back fitting, the first time we had a map so we could see, and I ended up with a 168 saddle on my road bike, which is really comfortable. It's very flat. So I picked a similar one from a gravel bike, but and I'm on the second one now. And what I'm finding is, although it's my seat width is 130, and I'm riding the 168, where my seat bones aren't sitting on the seat; they're kind of wrapping around it. And I'm thinking,
Okay.
that can't happen. That just doesn't make sense. And the saddle I'm on is very similar to the one on my road bike, shape-wise.
Mm-hmm. Similar in that it's the same width, but saddles have a taper as well. So is it very flat? You said your road bike is very flat, but does your gravel bike have a flare where the sides of it kind of taper off?
More so than the road bike. The road bike's very flat. It's really specialized.
So
So
that
the
could be why it feels like you're almost wrapping around your
ground.
saddle. The
Yeah.
other thing to consider too is, does your saddle need to be moved forwards so that the widest
Okay.
part of your saddle is actually underneath your sit bones? Or do you
Okay.
feel like you're having to ride while sitting more forward or on the nose of the saddle? And then that'll feel like you're wrapping around the
Yeah. I'm
saddle as
I'm
well.
I'm forever moving back to try and find that comfortable spot. Yeah. I'll try that.
Try to
Yeah.
get that saddle forwards. Yeah, I
Yeah.
think it needs to be
Okay.
underneath you more.
Yeah.
Yeah,
Thanks.
make
And
sure that you're feeling supported for sure.
the same question as the next one in the chat. Should your saddle feel comfortable? Like, should you be aware of it a little bit or not at all? Or sorry, so I'm overlapping somebody else's question. I'm done. Thanks.
It's such a tricky thing, right? Because we didn't evolve as human beings to sit on a bicycle seat. This is a very recent in the grand history of our bodies. This is a very recent change. And so the area is for, sitting on a wide chair, sitting on the ground. But it's also for sexual function. And so it serves a very sensitive purpose. And so having a saddle in that area can be uncomfortable. And so that's where the Holy Grail saddle search comes in.
Thanks very much for that. It's been really interesting. I've loved it. Thanks.
Thank
Very
you,
useful.
Julie.
Okay.
And then the question in the chat that was similar, it said, is a good saddle actually supposed to feel comfortable or just obviously not hurting or numbing?
I would say first and foremost, not hurting and not numbing. However, like I ride and I talk about saddle health all the time. And yeah, I get a little saddle sore as well. And so it is a hard thing to say like, oh, you should be completely perfectly comfortable. Everybody is different. And obviously the early times in the season you can feel a little bit sore, but the whole like, oh, you need to develop your, what did one of my athletes say? Leather lips. Oh my gosh, that term right there just, yeah, makes me cringe a little bit. You shouldn't have to harden your saddle area to be able to ride your bicycle. So I'd say if your discomfort comes on relatively early in your ride, like after 20, 30 minutes, but you plan on going out for an hour or two, then you're going to be uncomfortable for the majority of your ride. And that doesn't sound very fun. So I would definitely say if that's kind of the criteria that you're dealing with, then you might want to investigate A, whether your saddle's in the right position for you, or B, if it's the right saddle for you. And I will say that really squishy padded saddles is how we get away with it not being the right shape for you. Um, if the saddle is the right shape for you, it should be relatively comfortable to ride without even a chamois in your shorts. The chamois just gives you a little bit of cushioning so that you can ride for longer, but it should be the right shape so that you can actually just sit on it without a pad, and feel relatively comfortable. So think about that. Those super squishy gel seats and that sort of thing are just a way to get around. It's not the right saddle for you.
Thank you. We have another question in the chat. It says, I'm going to be doing some ultra endurance distant rides this summer with Ontario Randonneurs. The longest ride I'm thinking of doing will be a 400-kilometer brevet ride. I was planning on only wearing one pair of cycling shorts, but now I'm wondering if I should bring another pair and change. Is wearing one pair of shorts over 400 kilometers a recipe for infection?
That is an interesting question. And I feel like I could go either way. If you're like, oh, these are my perfect shorts, I love these. But you're going to be sweating in those shorts too. And so I would think a little time off the bike halfway through, even changing up the shorts partway through, is probably a nice idea. It might actually give you a bit of a like a refresher partway through that really long ride. But yeah, 400 in one shot is quite a lot. And so it's not unheard of, but if you have the ability to change up the shorts, I think I might. But I will be very curious to hear how it goes and what you decide to do. Is there any other questions? I see a thank you. So thank you so much for joining. Making sure we've got all the questions. Good.
Sorry,
Thank you.
can I ask another one?
Yeah, go for it, Christine.
I was the one that asked about the endurance. Okay, so the other thing, I have fairly good shorts. Like I spend between 150 to $200, right? So I like
That's what
Louis
they cost.
Garneau. Yeah.
Yeah.
I like Louis Garneau and I like Segoy. But because I'm doing these ultra distance, like, is it going up? And I think it's ASOS. I don't know how to pronounce it. I think it's the Swiss brand or the Italian ASOS.
So, yeah. Hmm.
They're like $400. Is that worth it? Like, at what is it worth $200 more in comfort? Like, I don't. What are your thoughts working with all of these different professional cyclists?
I have had my athletes tell me they love the ASOS
Okay, okay,
shorts. Yeah.
good.
But I would say if you like you it sounds like you already ride quite a lot and you find the LG shorts quite fine. So I would say, if you think about the criteria that we talked about, that it's covering the part of your pelvis that interacts with the bicycle seat. If it's in the right spot for aft, it's not broken down, it's in good condition, then I would say if you already find them comfortable, wonderful.
Okay, thank you. And I will say, you talked about bike fit for anyone else that's on this. I went and had a bike fit. So I live in Ancaster in the Hamilton area, and I was great that you're a McMaster graduate because I work at the university. I work at Mac, and I went to my local bike shop and I was like, I don't feel great on the saddle because I was trying to get to like 200 kilometers and it was feeling a little off. So my local bike shop recommended a guy in Guelph at Speed,
River.
Speed River, and
Yeah.
Tim
Tim
was
Plunkett.
was amazing. So all the women out
My
there, if
guy.
you live in sort of the Southern Ontario area, this Tim guy at Speed River Cycle, like he was amazing, and he has this little device that he puts on the saddle so you can see, and you had that alley, you showed the sort of the pressure points, and it
Yeah.
totally changed. I actually had to buy a new bike
Oh
because
no, it's
you were talking,
expensive.
yeah, it was expensive. But you had talked about, if your saddle is too high and your bars are too low, it changes the pressure. And I was in a way more
Breaks it too long.
aggressive because I was racing before and now I'm not racing. Like I'm just sort of noodling around. Anyway, I
Yeah.
highly recommend a bike fit. It has totally changed my world.
Yeah. And Tim is wonderful because his main priority is comfort. He gets a lot of people in there racing, but his main question is always around like, can you ride this for hours and hours and hours? And I always appreciate that because, a cyclist from, somebody with a racing background to somebody who's just trying it out, comfort is universal. And I tell my athletes this too, because they're like, oh, I just want to be aero. I want to go as fast as possible. I was like, well, you have to train on this bike too. And if it's more comfortable and you're able to train more hours, you're going to get faster. You're going to get fitter. And so saddle comfort is one of those really basic, very important things. And Tim at Speed River always asks about it. He doesn't mind talking about the vulva and soft tissues and numbness and that sort of thing. So I appreciate him very much.
He's great. Thank
Can
you.
I
This
ask
this
one
was
last question?
wonderful.
Yes.
So just on the saddle, on the bike fit. So I had a bike fit and it raised my seat to what was supposed to be appropriate seat height, but I noticed that I often felt a lot of pressure on the vulva, so I lowered it myself a little bit, and now I notice the sliding. So how do you like make sure your seat is right height, but then doesn't have that same thing, that pressure? Do I
So you're
just need to go
sliding,
too low? I'm
you're sliding
sliding it, yeah, and
forwards.
if I'm sliding a little forwards, I have to bring myself back all the time, but like I have to scoot back. And
Yeah.
then I also notice if I raise it to the height where the fitter made it, then when I ride, I feel the pressure on the vulva, which I've never felt before.
So it's really important to remember that so your foot is fixed to the pedal and the saddle, the seat post where your saddle travels up and down on is not straight up and down. It's on an angle. And so if you raise your saddle, you're essentially moving the saddle further away or further back. And if you lower the saddle, you're moving it forwards. And so by lowering the saddle to get more comfortable, you may be changing where the fore aft position should be. So it sounds like you may actually need to move the saddle forwards a little bit because you're ending up on the nose and then you have to shuffle your butt back. So make the saddle meet you where you want to sit and where you want to pedal.
And then how do I like make sure that, because technically I'm quote unquote too low now as per the the math of my height and the saddle, but if I go to the right number, then it doesn't feel right.
Forget about the math. Our body doesn't math. Our body doesn't math. So if they measure your inseam and they do the like times 0.8, whatever, I forget what the number is. I don't like the number because our bodies don't math. We are very dynamic structures. And so our flexibility is different from one person to the next. Our amount of range of motion from the ankle to the knee to the hip to our low back, how we like to sit on the saddle will change our hamstring length. And so if you are a person with short hamstrings, then you have to have a lower saddle than maybe what the length of your leg says it should be. And so that's where the math, if the math isn't mathing, then forget about the math and just go with what feels good. And this is my favorite thing about, again, I'm going to talk about Tim. I wish there were more female fitters. There isn't. But anyways, Tim's our next best option here in Ontario. He doesn't measure your your body. He looks at you, he videotapes it, he does the saddle pressure mapping, so he gets some objective data from that, but it's about how you feel on the bike and whether you find it comfortable or not. And he can adjust based on that.
Okay, thank you.
You're welcome.
Can I ask another question, please?
Go for it.
Okay. So, uh, you know the SQ Labs saddles, and they keep saying about we've researched this and that, and it's like the holy grail. I want to try one of these saddles, and my local bike shop has one in that would fit, and they won't let me buy it, try it, and take it back. Do you have any opinions on the SQ Lab saddles, particularly that it goes it's higher at the back and then it goes down a little bit and moves either side? And have you heard any feedback? Because I noticed there wasn't one in your lineup or anything.
Yeah, I don't want to necessarily comment on a specific brand. I don't have any loyalty to a specific brand, and maybe they've done a whole lot of research and that's great. But I've talked to people who develop saddles and research saddles, and what they think they knew usually changes from year to year. And they used to make women's saddles really, really wide because we have such giant pelvises. And then oh, wait, they actually have muscles as well on that pelvis. And women have, we carry our weight in our thighs and that sort of thing. So our thighs tend to chafe on these super wide saddles. And okay, now we're going to bring them back a little bit narrower again. And so what they think they knew and what ends up, being put out there changes from year to year. And so if they won't let you try I wouldn't spend the money on it because you don't know if you're going to like it, even if they say this is the next best thing since sliced bread.
Great answer. Thank you. Thanks very much.
No problem. I think is that it? We've gone over time. I think it's just us and Julia and Christine hanging out now. Oh, there's a few more. Okay, good. Great questions, everyone. Thank you so much for joining.
Okay, yeah, I think that's it for questions. Thank you, Ali, so much. That was such a great presentation. I definitely learned a lot. Sounds like everyone in the chat loved it as well. So thank you so much for being here and doing another year and contributing to Women's Month again. So we really appreciate it.
Thank
Thank
you.
you everyone for joining us on this Monday night. We will have the presentation or the recording available on YouTube, and we'll send a link to everyone who registered after. And then most likely tomorrow. And then we have some other webinars coming up. So we have one about nutrition for women, specifically women with perimenopause or going through menopause. And then just last week we did a webinar on bike fitting as well. So those are available as well. And then you can sign up for the one about nutrition, which I think is next week. So lots more to come for Women's Month. And you can check out our calendar and lots of group rides and activities. So thanks again, everyone. Happy Women's Month. And thank you, Ali, for joining us.
Thank you so much.
Thank you.